I want to thank you all for joining us for the Minority Health Month Proclamation. I am Councilmember Lori Ann Sayles and the lead for eliminating disparities in public health. So I am honored to be joined by my two colleagues, Council Vice President Jawando, who chairs our Education and Culture Committee, and Councilmember Albornoz, who is joining us virtually, who chairs our Health and Human Services Committee. Although Montgomery County is proud to be recognized as one of the healthiest counties in the nation, we still face significant economic and racial disparities in healthcare, as evidenced by some concerning statistics. For example, nearly 1 in 6 residents rely on Medicaid for healthcare services, benefits that are currently at risk at the federal and state levels. Black babies are more likely than babies of any other race to have low or very low birth rates, and our Hispanic population has a higher preterm birth rate than white residents. These are key risk factors that contribute to infant mortality. The Montgomery County 2024 Community Health Assessment found that nearly a third of Hispanic or Latino residents were only sometimes or never able to get health care when needed, compared with 7% of non-Hispanic residents. The same assessments found that people who identified as agender, gender fluid, non-binary, or transgender were more likely to consider access to medical care challenging or somewhat tricky. These disparities stem from broader systemic social issues like food insecurity, lack of housing, and economic instability. Nonetheless, Montgomery County is committed to diversity, equity, and inclusion despite federal threats to these values. We will continue working collaboratively to care for our community together. I want to recognize everyone here today who shares our mission, especially our 3 minority health programs. The Latino Health Initiative, the African American Health Program, and the Asian American Health Initiative. And amazing. Today, we reaffirm our commitment to ensure access to quality health care and preventative services, including gender-affirming care. I look forward to working together to improve healthcare access and outcomes for all residents through a racial equity and social justice lens. And now I want to welcome my Council Vice President colleague, followed by Councilmember Albornoz and our special guest speaker, Dr. Ngozi Wexler, an obstetrician at MedStar Hospital, who will discuss her work on maternal health disparities. Thank you.
Thank you, Councilmember Sayles. Good morning, everyone. Happy April, and happy National Minority Health Month. I'll be brief and be additive. There's a lot going on right now, and whether it's mental health, whether it's physical health, whether it's social emotional health, we know that in our communities, communities of color, the toll is bigger, it's deeper, it's more systemic. I was on a panel this weekend at there's a great play at the Only Theater called Sleepover. You should go see it. It's there for a couple of weeks. God bless you. It's about 3 or 4 young women who are all from the Black diaspora, different parts of the diaspora, and they're talking about all the many issues impacting them at their first ever sleepover. They're teenagers. And one of the things that they came up and brought up was, how do you present to go out to the world every day? What do I do with my hair? How do I get up? What do I wear? How are people going to perceive me? It's one of the many, many things impacting the mental health, the physical health of people of color. There's a long list. You heard some of the medical diagnoses, but it's one of the reasons that this council, I authored a resolution a couple years ago declaring racism a public health crisis. When you see your neighbors being rounded up without due process, when you see people being fired for no reason, when you see people who are supposed to protect our public health being fired. Just today, people showed up at FDA and their badges didn't work. 10,000 HHS employees. I'm proud that we're in a county where we care about everyone's health. And so we have to double down and say that we recognize these systemic and institutional factors that lead to worse health outcomes for our communities of color. and then we have to play to our strengths and make sure we support. And that's what our health programs do. So I really appreciate Councilmember Sayles and all of her work on this. I'm proud to be on a council and in a county that recognizes that this is important work, because we're healthier as a community. That's good for everybody. Turn it over to my colleague virtually and chair of the HHS committee, Councilmember Albornoz.
Well, thank you both. And in a bit of irony, I am homesick today and not able to join all of you, but that is an all-star group that I see on my screen before me. And we're going to need all of you to help us get through what we know is going to be yet another challenging time. We cannot go backwards. And during these disorienting and frustrating and frankly enraging times, I've lost a lot of sleep. I'm sure a lot of you have as well. But what has gotten me through these difficult times is the knowledge that we have such a strong public health infrastructure here in Montgomery County. And if you look back on COVID, as difficult and as tragic as that time was, think about the innovative practices that were born out of that really difficult time. We were able to establish the Office of Food Systems Resilience, the Black Physicians Network, our hubs, and each of our African American Health Program, Latino Health Initiative, and Asian American Health Initiatives did some groundbreaking work and significantly expanded their reach through some really strategic thinking and partnerships. So we're going to need all of that and more to make sure that, again, we don't go backward and we move forward. But I am proud, as Chair of Health and Human Services, and also for 12 years as the Director of Recreation, I'm intimately familiar with our public health infrastructure here in Montgomery County. And I want to thank our colleagues in HHS and our public health team, who are all-stars in their own right. Thank you all so much for your dedication and commitment, and we look forward to partnering on so many more opportunities moving forward. Thanks.
All right. There you are. Come on, doctor. All right.
Good morning, everyone, and thank you for inviting me. I'm Ngozi Wexler, the Chief Medical Officer of MedStar Montgomery Medical Center. MedStar Montgomery is one of 10 hospitals at MedStar Health. MedStar Health, provides services across Maryland and D.C. And as Chief Medical Officer and an OBGYN physician, the issue of decreasing severe maternal morbidity is something that is very near and close to my heart, especially when we have racial disparities in this arena. And my colleagues and I are very passionate about closing those gaps and decreasing disparities for all. At MedStar Health, we recognize that the ongoing maternal health crisis affects not only our county, but our state and our nation. And severe maternal morbidity, which you will normally hear us refer to as SMM, disproportionately impacts women of color. And at MedStar Health, we choose to be bold in taking decisive action to ensure equitable care and safer outcomes for all of our mothers. Regarding our strategy for change, MedStar Health has built an operational infrastructure for health equity that is fully integrated in our clinical governance framework. We focus on reducing healthcare disparities, of course, in severe maternal morbidity, but also in all other areas of medicine. We really work with our colleagues to optimize health equity data collection. We ensure equitable care delivery, and we address unmet social needs. Our action plans to improve maternal health is very comprehensive. We're tackling postpartum hemorrhage, which we have identified as a key driver in severe maternal morbidity, through safety event reviews in every single postpartum hemorrhage case that we have in our labor and delivery units. We also provide expert oversight in this area to improve our clinical protocols to ensure we have good outcomes for all of our patients. Our initiatives that we've been implementing recently include implementing Code OB hemorrhage activation protocols. I'm sure you're all aware of Code Blues. We now have Code OB and Code OB hemorrhage to make sure that we are ensuring that rapid response to emergencies. We are expanding the postpartum hemorrhage simulation drills in our hospitals to ensure that we have enhanced preparedness for all of our patients. We conduct risk assessments and pre-delivery timeouts for every patient to ensure we have that timely intervention for all. We've also increased access to iron infusions for patients who are pregnant in the pre-delivery time period, because ideally, if you decrease that risk of anemia by giving iron, then you don't have that increased postpartum hemorrhage that leads to all the bad outcomes when you do come into labor and delivery and it's almost too late. However, when you do come to labor and delivery, we're also doing things there. We're giving a medicine called tranexamic acid, among other medicines that help to constrict the blood vessels to decrease that risk of bleeding despite all of the things that may put you at risk. Now, recognizing that collaboration has to happen not only in our small hospital, but across all our MedStar entities and our outside of our MedStar hospital walls, we work with other MedStar hospitals to share our protocols, our best practices, our clinical policies. We share information with each other, and we ask each other to look through our records to make sure we did the things right. But I'll be remiss without giving good credit to our community partners beyond our hospital walls. We recently, we had a meeting yesterday with the African American Health Program, SMILE program, to see how we can engage with our colleagues there to get caseworkers to come to visit our patients in their homes during pregnancy and up until 1 year after delivery to make sure that no patient is left behind. We are also partnering with the MD Mom program and those initiatives to help decrease the risk of hypertension. We're providing education on implicit bias. We are also working to make sure that patients have access to donor breast milk if they choose to give breast milk to all their babies. I would be remiss if I didn't also recognize the excellence of others who have worked diligently and tirelessly with me to make sure that we're making all these changes. And so I would like to give some kudos to the chair of our OBGYN department, Dr. Sujitra Jairaj, the vice chair of our department, Dr. Amy Blunt, director of quality and safety, Linda Sue, and our director of risk management and patient safety, Caroline Frazier, and of course our nurse director, because we can't do it all as doctors. We need our nurse colleagues too, Dina McDonald. They have really owned this problem locally and really taken it by the horn, and have really worked hard to make sure. And so I'll just end with this final, note that at MedStar Montgomery and at MedStar Health, we are committed to ensuring that every mother, regardless of background, receives the highest standard of care, regardless of where they might live, what they might earn, or what the color of their skin is. And together, we are shaping a future where maternal health disparities will truly be a thing of the past. Thank you.
Thank you, Dr. Ngozi. And I would be remiss if I didn't let our expert attendees introduce themselves as well briefly.
Hi, I'm Mayur Modi with the American Diversity Group, Executive Director and also steering member of Asian American Health Initiative.
Hi, my name is Juan Deng, and I'm with the Maryland Vietnamese Mutual Association.
Hi, my name is Nguyen Nguyen. I am the Vice Chair of the Asian American Health Initiative Steering Committee.
Ngazi Wexler, Chief Medical Officer, MedStar Montgomery Medical Center.
Jackie Williams, Co-Chair of the African American Health Program Executive Committee, the board.
Dr. Pat Grant with the African American Health Program.
Marcela Campoli, Co-Chair for the Latino Health Steering Committee.
Good morning, James Bridgers, the Director of the Department of Health and Human Services.
Good morning, Dr. Keisha Davis, County Health Officer.
Good morning, Ana Mejia with the Welcome Back Center program of the Latino Health Initiative.
Good morning, Ingrid Lizama, Latino Health Initiative.
Good morning, Karen Bernal with the Fetal and Infant Mortality Review Board.
Good morning, Angeline Bell with the Babies Born Healthy program.
Good morning, I'm Crystal Trent Paltray, nurse with the Babies Born Healthy program.
Good morning, Dr. Nina Ashford, Chief of Public Health Services.
Buenos días, Mariana Serrani, Manager of the Latino Health Initiative.
Good morning, Monica Martin, Chief of Behavioral Health and Crisis Services at HHS.
Good morning, buenos días, Roberto Garza Rodriguez with the Latino Health Initiative.
Thank you so much. We're going to read the proclamation now. And Councilman Albornoz will handle it for you here.
All right. Whereas National Minority Health Month highlights the disparities in premature death and illness affecting racial and ethnic minority groups, in Montgomery County, one of the most diverse counties in the United States, it's crucial to offer healthcare services and resources that reflect this diversity. And
Whereas this year's theme, Advancing Commitments to Eliminate Health Disparities, highlights the importance of improving healthcare systems and ensuring equitable access to resources for all residents. And
whereas, while Montgomery County ranks among the healthiest counties in the United States with high vaccination rates, more healthcare providers per resident, longer life expectancies than state and national averages, lower rates of disconnected youth, and preventable hospital stays, these benefits are not evenly experienced across all populations in the county due to health disparities impacting communities of color in Montgomery County. And
whereas health disparities are evident in various conditions, with higher cardiovascular disease and maternal morbidity rates among African Americans, and increased diabetes rates in Native American, Hispanic, and Black populations. Mental health issues often go untreated, and access to health care is limited for low-income and rural communities. Additionally, Black and Hispanic populations face higher cancer rates, asthma prevalence, and obesity rates, and are disproportionately affected by HIV and AIDS, highlighting the need for targeted interventions. And
whereas we remain committed to achieving the tenets of Healthy People 2030 to eliminate health disparities and create fair opportunities for people to live healthy lives by investing in cultural competency, research, innovation, community engagement, and a holistic view of healthcare to enhance services and meet the needs of our increasingly diverse community. And
whereas safeguarding access to essential health services, including gender-affirming care, reproductive health, and preventative screenings, must prioritize residents with disabilities, members of our LGBTQ+ community, veterans, racial and ethnic groups, and other marginalized populations, ultimately aiming to enhance health outcomes for these communities. And
whereas Montgomery County is committed to cultivating academic diversity in the healthcare system and medical professions, addressing the social and structural determinants of health disparities, and partnering with local providers, community and faith-based organizations, minority health programs, and individuals to promote equitable healthcare and eliminate health disparities in under-resourced communities. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes Minority Health Month as a critical month to further progress on reducing global and local health disparities for minorities, presented on this first day of April in the year 2025. By Council Members Sayles, Albornoz, Vice President Jawando, and President Stewart. Thank you.